Dear friends, I'm Dr. Neha Gupta, infectious diseases specialist and specialist in HIV medicine in Medanta the Medicity, Gurgaon. HIV/AIDS affects millions of people all around the world and has been around for decades. Still, myths continue to persist. In the 80s and 90s, HIV and AIDS was considered to be life threatening, but now things have changed. With the advances in the medical sciences, now we have new, safer, and efficacious anti-retroviral drugs which are available, which have transformed HIV from a death sentence to a more manageable illness like diabetes and blood pressure. We also know that it doesn't happen or it doesn't spread by shaking hands or by sharing toilets, food, or drinks. So, socially accepting the people living with HIV is important and we must provide them care and support. Earlier, it was thought that the medications for HIV may be harmful, but now we have good, effective, and safe medications available for HIV. And by taking these medications, people can lead a normal life. Whoever is HIV positive, all of them must take the antiretroviral drugs, and that should be irrespective of their CD4 count. However, we all know that still there is no cure for this particular disease, and the therapy has to be taken lifelong. So, previously, when we didn't have safe drugs available, patients were started on antiretroviral therapy when the CD4 count would go down below 200. But now, since we have better medications and effective medications available, now the concept has changed. And in fact, in 2016, that has been the game changer. Anybody who's HIV positive should start on the medications. The concept is that as we start early, we can prevent infections, including opportunistic infections, and also many diseases like heart attacks, which can be as a result of inflammation in HIV positive patients, and even malignancies, tumors, they can be prevented by starting the therapy early. So now today it's anybody who's positive, it's very important to take the medications as early as possible, and as they are safe, most of them are well tolerated. The side effects are also very less. Once you're detected diabetic, you have to take the medications, and with proper medication, diabetes is under control. People living with diabetes also live a normal life. Same as that with HIV now. It's like a chronic manageable illness. With proper medication, it can be under control. Now, no one should get this virus. It's important to curtail the spread of the virus, and for this, we must follow safe sex practices, avoid use of contaminated syringes, and at the same time, before marriage, besides the horoscope, it's very important to know the HIV status of the partner. H1N1 छूने से फैल सकता है, like if you're touching doors and वहाँ पे viruses are probably H1N1 या फिर influenza या फिर any other normal cold virus can spread through sneezing or even by touching of the doors. But this HIV virus, that doesn't spread like this. It doesn't spread by touching doors or any object which is just left in the open. काफ़ी लोग ऐसा समझते हैं कि खांसने से या किसी के सेक्रीशंस, ओरल सेक्रीशन से HIV हो सकता है, बट ऐसा नहीं है. HIV वायरस, it gets killed when exposed to air. So it doesn't spread by the secretion, sneeze of a person, of a sneezing or coughing from an HIV infected patient. Transmission doesn't happen. There are just three methods. We all know that it's only three methods, like it's unsafe sex practices, use of contaminated syringes, which is like, and then obviously from mother to baby. So if these three modes of transmission are taken care of, then nobody is going to get HIV infection as such. If the mother is HIV positive and that's detected, if suppose she is pregnant and is detected HIV positive, it's by taking the medications, we can prevent the spread of infection from the mother to the baby, and the baby can be HIV negative. So taking medications appropriately during pregnancy is very important. So what I know, and I've seen them, it's like they are, when they get to know at the age of say 10 or 12, Because that's when suppose there's a baby who's like 3-4 years old, he won't understand that he's positive. He won't understand the gravity of HIV infection. But at 12 years, you know, and you are really looking forward to life, and that's when you get to know that you are HIV positive. So it affects them. But again, it's the whole, besides the medications, it's the support from the family which is important. So parents have to take care of themselves, take proper medications, and then give some more support, emotional as well as financial support, to the children at this stage. And with that, I think a lot of people who are coming to us, obviously, children are fine. They are starting to accept that they are positive, and also accept that by taking medications they can actually lead a normal life. What it affects is obviously like the chances of getting a partner in the future. Like, that a partner is we all need company in our lives. But that's something which is, that that is something called destiny. Whether they find somebody or not, because that's very important, but it's destiny. Maybe with more and more acceptance, this can also happen in the future. It's for us as a society to accept people. That's very, and as you said, like, not discriminate them, but accept them. Then most importantly, it doesn't spread by touching, shaking. You can, by sharing food, drinks, it doesn't happen. Exactly. So they can be friends, they can be colleagues, hug each other. That's absolutely fine. Ideally, the blood should be checked with NAT PCR. NAT PCR is more sensitive, and also it can detect an HIV infection at a very between 2 to 7 days. Okay. Like with the ELISA test or with the P24 antigen 4th generation ELISA, it has still a window period of 15 days. But with this particular NAT PCR, the detection or the window period is reduced to between just 2 to 5 days. So that's why all these blood products before transfusing should be checked with NAT PCR. So on this World AIDS Day, let's spread awareness and help people lead a normal life with HIV. It's important to prevent new infections, and that should be our aim. Thank you.